Welcome to today's presentation and introduction to dental therapy education programs. My name is Bridget Walsh, and I am Senior Policy Manager at the Schuyler Center in Albany, New York. For those of you who don't know, the Schuyler Center is a statewide multi-issue policy and advocacy organization. Our focus is children and families, primarily those experiencing poverty. Many of you have participated in our Future Oral Health Workforce Project, and we're delighted to see you here today. Just a little bit of housekeeping. The slides and the recording will be on our website in the next day or so. And we're presenting the webinar in a webinar format today. So please use the Q&A feature for questions, and we will field them at the end. Several months ago, a group of partners unveiled the New York State Partnership for Dental Therapy. If you haven't visited our site, I'm going to drop the link in the chat, or you can use the QR code. This initiative came together to provide education about the profession of dental therapy and to support its authorization in New York. On the website, you can join our movement and show your support, and you can also sign up for newsletters that will keep you informed about new research, upcoming webinars, blogs, videos, and more. So stay connected with us and reach out if you would like to connect. I'm going to drop those links in the chat in a minute. So we have three speakers today. First is Laura Brannon. Many of you saw her Dental Therapy 101 webinar she did with us a few weeks ago, and it's up on our website. We're pleased to have two dental therapy educators with us today. They will talk about their programs and give an overview of the educational process in different settings. We get a lot of questions about education, so we're so pleased that Dr. Self and Dr. Warren are spending some time with us today. And so with that, I am going to turn it over to Laura.
Thank you so much, Bridget. Happy to be here. So I'm just going to give you a quick overview, sort of laying the land before I hand it over to Doctors Warren and Self to really do a deep dive on how their education programs work. So, just to make sure everyone's on the same page, what is a dental therapist? Well, despite the name, they are not therapists who talk about your fear of the dentist. They are credentialed oral health professionals. So they are licensed or certified the same way that any other dental professional would be working in that circumstance. Usually that means state licensed. They work under a dentist supervision. That supervision can mean in the same room, or it can mean using telehealth and collaboration and standing orders the same way a nurse practitioner or a physician assistant might work. And they provide both preventive and restorative care. So that means that they can do things like exams, fluoride varnish, sealants, oral health instruction. They can also actually treat problems. And this is really important because untreated dental decay is incredibly common in this country. Small cavities start out as something that is fairly simple to fix, at least in terms of dentistry, but can become very expensive and require extensive work, and that is quite frankly very painful and has extensive impacts on a person's health. So we know that prevention is great, early treatment is important, and the more that we can get actual care to people early on and regularly, the healthier they are likely to end up. And so dental therapists fill this gap in helping more people get routine dental care while still working as part of a dentist-led team. Uh, Dental therapists can work in traditional dental clinics, whether that is a private practice or a community health center style clinic. But they can also go into community settings, and whether that means using portable equipment to go into a school or a nursing home, they can staff sort of those mobile dental clinics, or even some folks have figured out how to use a hub and spoke model of sort of smaller satellite clinics, primarily equipped or primarily staffed by dental therapists with a supervising dentist sort of at a larger clinic or traveling between the smaller clinics. So the idea of this is really to help bring care to the folks who need it most, whether that is folks in rural communities, tribal communities, low income communities, or people who have trouble getting to the dentist, particularly people with disabilities, seniors in care facilities, kids in schools even. We know a lot of people are not able to get dental care, and less than half of Americans every year receive any dental care. So there's a huge number of people not getting important health care. And dental therapy is not a new thing. I think a lot of times people, when they first encounter it, they think, "Wow, this is kind of new." It's actually not. It's dental therapists have been working for over a century globally, and they've been working for over 20 years in the United States. First in Alaska tribal communities, then in Minnesota, where Dr. Self is from today, and then embraced by communities across the country, realizing that access to oral health care is not a uniquely rural problem. It is not a uniquely tribal problem. It's a problem that is impacting communities across the across the country, whether they're in rural or urban areas, and that this is an idea that can help in a lot of those settings. So, where are dental therapists? So, you see, dental therapists are authorized to work in at least some settings in 14 states, and they are being considered in a number more states. I know Skylar, which is hosting our webinar here today, is in New York, and there's a bill in New York. There's also legislation that was introduced this year in Massachusetts, Illinois, and Florida, and there are efforts also to authorize in Oklahoma and California. I should also say I frequently have trouble keeping this map up to date because there are so many new states looking at it all the time. So this is very much a growing profession. So Dr. Warren and Dr. Self are going to really do a deep dive on how their education programs work. But I want to talk a little bit about how dental therapy education standards work to help you understand that there's actually quite a bit of flexibility that is allowed. So most states require that dental therapists finish programs, graduate from programs accredited by the Commission on Dental Accreditation, which is the same entity that accredits dental schools or schools that train dental hygienists. It's called CODA. They are housed within the American Dental Association. They're the sole entity that's allowed to accredit education for oral health professionals in the United States. CODA sets standards and then they accredit programs. So they say this is the standards you have to meet, and then they review programs, both new programs and existing programs periodically to make sure that they are setting those standards. I should say, as Dr. Self might mention when he says it, that while states frequently do require CODA accreditation, because the CODA standards were developed in reaction to the success of dental therapy in the US, several states, including Minnesota, allow an alternate pathway as well. And in Minnesota, the Minnesota, I believe, Dental Board can also approve education programs. And because, again, those CODA standards were developed in reaction to the success of dental therapy. So the programs came first, then CODA was developed, although I know many of the programs are going back through the process now, even if they had pre-existed CODA. So what do the CODA standards say? Well, they say programs have to be a minimum of 3 academic years, so that means 6 semesters. They can run year round, so that means you don't have to give a summer semester off, which particularly for students who are maybe non-traditional students or returning students, that can be really nice because it helps them get into the workforce more quickly. So as I mentioned, they set the accreditation standards, which means they basically set sort of uh, rules about what needs to be included in a student's education, about competency, about a lot of these things. And one of it is a minimum scope, a minimum set of procedures that students have to learn. This holds students to the same standards across all professions. So the standard to do a procedure that is in both a dentist and a dental therapist scope, it is the same standard, the same quality, the same competency is expected, regardless of which professional it is performing that particular service. CODA doesn't require a specific degree or any prerequisites before one becomes a dental therapist. I'll talk on the next slide a little bit about the fact that there are some states that do, but CODA itself does not require that dental therapists previously have a dental hygiene degree or have any specific sort of training in particular beforehand. So, as I mentioned, CODA is really setting standards and then allowing schools to sort of figure out how it wants to meet them, how based off of their school and their community, what the best way of doing that is. And so that means leaving the degree level up to the school. However, there are 2 states, Minnesota and Maine, that do have a degree requirement in the law. Minnesota requiring a bachelor's or a master's, depending on sort of the exact situation, and Maine requiring a master's. And then there are also some states that do require dental therapists hold a dental hygiene degree in at least some situations as well. So again, these are specifically in the state laws and not in those accreditation standards. So I know as you're here presentations here today, you're going to see dental therapy programs that look pretty different. And I think an important thing to remember is that with the CODA standards, there's a lot of room for flexibility for educators to figure out how they want to develop a program to meet the needs of their students, offering things like advanced standing for dental hygienists or dental assistants, offering programs at varying degree levels depending on what the school is. The standards are ensuring about quality, about competency, but also leaving a lot up to states and to education programs. So with that, I will hand it back to Bridget. Thank you.
Um, okay, Dr. Warren,
All
you,
right, I'm gonna try to share my slides.
all right.
Is that working?
Yes, there you go.
Okay. All right. Good afternoon. I'm Cheyenne Warren. I'm a dentist and I'm the program director of the Divide Boost Dental Therapy program at Skagit Valley College in Mount Vernon, Washington. So I'm really excited to be with you guys this afternoon. I hope that you can take away some things as I know you all are champions and interested in starting programs in your state. So hopefully we have some lessons learned and some exciting news for you. So just a little bit of history and background of our program. This is our main site. This is at Skagit Valley College. This is our Angst Hall is the name of our building. And we are just one classroom dedicated to our entire program in this building, but it's brand new. No one else at the college uses it, and we're pretty excited about it. And so I'll show you. This is the inside, and I kind of have it behind me in my background, our simulation lab where we've set up 3 pods of 4 stations. So we have 12 simulation stations for our students in this area. And so that's kind of how it's set up in one instructor pod. And then just down the road, about 25 minutes, is our clinical site. This is our Swinomish Dental Clinic. The Swinomish tribe was I'll kind of go into the background, but the program wouldn't be in existence if it hadn't been so community driven. So to tell you a little bit about the history, it's probably 14 to 17 years in the making of when the Swinomish tribe decided that they were really interested in learning more about dental therapy. And at the time, the chairman was a leader named Brian Cloudesby. He heard about dental therapy in Alaska. He took a trip to Alaska to say, like, what's going on here? And he visited the program in Alaska and just was so excited and thought, this is exactly what our community needs to meet access to care. And so he came back to Washington State, started doing some research about what this was going to take. And then fast forward a lot of work, they eventually sent 2 Swinomish tribal members up to the Alaska program to be trained to then bring their education back to the tribe. So that happened in 2017. They sent 2 dental therapists and then they came back. And at that point, they were working on also starting the education program at the site. So when you look at this image, you see that there's sort of 2 mirrored buildings. The building to the left was originally the tribal's dental clinic. That didn't always exist. They started with a trailer and had a rotating dentist that would come and work out of the trailer in a parking lot. And that created a long history in the tribe where people were very afraid and there was a lot of sort of trauma in the tribe around dental and oral health care. But they eventually found a dentist that stayed and then they built this beautiful clinic. And then their goal when they wanted to expand it to education was they needed more chairs and more ability at the clinic. So they doubled in size. So that's how you see the mirrored side is really where our dental therapy education occurs. But we're housed in the same building that all their dental care occurs with their normal dentists and hygienists and staffing. And it's beautiful. And so we're very lucky to have it. And so then after that, our program was finally able to receive CODA accreditation in the fall of 2022. And we started with a class of 6 all tribal students. We had the ability to offer 12, but we started a little bit small to make sure that everything was working well. And we had 6 tribal members start that fall. And then sort of another key milestone, aside from we graduated our first cohort of students in 2025, was that as of today, we have one of the two dental therapists that originally went up to Alaska to get trained is starting dental school in Washington. So the tribe has come such a long way with their origin story, 17 years in the making, from the leadership and the vision that Brian Clattersby had into what they're doing and providing for the community today, which is very exciting. So this is sort of just more of a peek at the clinic. We have 6 dedicated chairs to the program in the clinic. There are these 4 in the back that you see. Those are our main operatories. And then we have 2 closed operatories that we have that have nitrous oxide. And then the rest of the dental clinic is also available. And we have classroom space for our students downstairs as well, and offices. So I'm just going to give you some key information about our program and why it's been so important for access. I think really this was community driven, and they wanted to ensure that the curriculum was still attainable, and there were reduced barriers for all of the professional shortage areas, including tribal health. And so that's sort of the inspiration for the program. The very name Defy Boost is the Lushootseed word for place of smiles. And that is the native Swinomish term for it. And so they're really weaving this throughout our curriculum to just have us always understand the value and why the program was inspired and who we're trying to serve. And so I'm going to just go through here. So a little bit more about the program. Our program is an associate's degree. We are moving into a bachelor's degree. And the reason behind that was that when they envisioned the program in Alaska, it was an associate's degree. And that was really important for Chairman Clattersby to make sure that we were not creating barriers that students would perceive this is an education that we can't attain, it's too long, it's too hard. And so they really wanted it an associate's degree. The difficulty in that is when we truly put the hours together for the CODA accredited program, it's around, for our system, 176 credits. And that is 4 credits shy in a quarter system to a bachelor's degree. And so we are moving to allow students to do a bachelor's degree completion so that if they want to attain that, they can, and we facilitate that. We are CODA accredited. We have a cohort model. We can take 12 students. And one of the key exciting parts is the education is at our clinical site. And then we have a lot of additional clinical sites. So our students aren't sort of getting the education in the typical institutional environment. They're getting their curriculum out in a working clinical site, which just improves, I believe, our access to more patient experiences. So I've given you a little bit about this. Our whole program is 3 academic years, actually more than that, 176 credits, but we do this in 30 months. So it is very accelerated. Students come in, right now they come in the summer. If they have any general education courses to complete, then they start in the fall. And then from that fall quarter on, they're with us pretty much 40 hours a week, whether they're in the simulation lab at the Mount Vernon campus. Primarily, they spend their entire year 1 doing preclinical and didactic in that simulation lab. And then for year 2, they move over to the community site at the Swinomish Dental Clinic. They still have some classroom time, but they're in the clinic most every day or at some community rotation sites. And then as they get to quarter 10, which is their final fall quarter, they all go to different preceptorship sites, which could be around the state of Washington, or because we educate students from Colorado, Michigan, Oregon, sometimes the students are going back to preceptorship sites in their home states and communities for that last quarter, which is about 10 to 12 weeks long, depending on how many clinical opportunities they have throughout the program. Our total tuition is around $120,000 for the entire program. So here is a picture of our first graduating class and a lot of our team. And so that happened in June of 2025. And so we're really excited. We have fully educated 3 cohorts almost to this point. Our last cohort is graduating this December, and then we have a new cohort starting this fall, and we are fully enrolled at 12 for this fall. We have educated now mostly dental assistants, although we do have some students coming in this new cohort who have no previous clinical dental experience. They may have worked in a dental office or shadowed or something like that, but they weren't dental assistants or a dental hygienist. So that is brand new for our program, but most of the time students have either been a dental hygienist or a dental assistant. The prerequisite for our program is not a ton of hours. So we are, again, trying to reduce barriers. So we have about 50 hours where students are required to do some sort of shadowing experience to just make sure they know what they're getting into before they come into the program. So Laura kind of touched on this, our CODA accredited standards. It just kind of talks about how we make sure the students are competent in diagnosis and treatment planning within their scope, both pediatric and adult restorative procedures, preventative services with pain management, extractions, and limited oral exams. We focus on their professionalism, making evidence-based decision-making, and interprofessional collaboration. We also do a lot with culturally responsive care, trauma-informed care. We are adding a community rotation site working with patients with special needs or developmental and physical disabilities. And so these are just really important components of the training. They also work with mobile equipment and on mobile, like a dental van or a community van in various parts of the state. So right now we have 100% employment of our graduates. We've had 100% passage of a clinical board exam. Our program has gone with the ADEX board exam, and that's been quite successful for us. They did in Washington add that all of our students, because the scope in Washington is expanded to periodontal scaling and root planing, even though our students do not have to be dental hygienists, they do have to pass the clinical dental board exam that dental hygienists would take in Washington. So we do that as well. So we're doing the regular restorative exam, a pediatric exam, and the hygiene board exam. And so our students are now working in Washington, Oregon, and Michigan. And we have a student that's going back to Arizona, Colorado, and soon to be Vermont. So we're just continuing to educate students from all over the country. In Washington, students are only allowed to practice in community health centers or tribal clinics in public health settings. But our students are now in different states going back to all practice models. And so as we continue to evolve for our program, we're just continuing to look for making the program and training accessible. Some of the hardest parts have been sort of that tuition gap between what students are typically paying in a community college setting and how expensive dental education is to offer to students. So we're working on that. And one of the things that's another reason for moving towards the baccalaureate program is that students do have access to a little bit more funding in a baccalaureate program than they do with an associate's degree. And so even though we have a really credit-heavy program, their access to financial aid is reduced when it's an associate's degree. So we're working on doing some of those things. We're building more and more collaborative sites around the state so our students get a great experience. We love supporting tribal sovereignty in healthcare, and our students not only rotate and have experiences at the Swinomish Tribal Dental Clinic, but we have other tribal clinics that they go to as well that have been extremely supportive. And we also have a FQHC that has many sites around the state that has just started taking our students on rotation, and that's also been very positive. So we know that I'm super supportive of any program that wants to find multiple pathways to educate in dental therapy. I believe that we need future dental therapy educators, and so that master's degree is kind of a key component of that. I don't think that you need that to necessarily practice as a dental therapist, but to go back and be an educator. So creating sort of a career laddering pathway where students could go on and get a master's in public health or in education or oral health science would be really wonderful for the profession. And then that's pretty much it. We're trying to do a lot of the curriculum so students might not have to move so far away in their state. Eventually, we hope that our year one curriculum could be delivered a little bit more remotely. Right now, it's really important for students to come on site, do everything with the instructor. And so we work on calibrating other sites so that if we ever did want to move to students being cohorted maybe 3 hours away in Eastern Washington, they could do so through a calibrated site and take a lot of their classes through a live Zoom class, but still have a hands-on educator. So those are some of the things that we're trying to move for in the future as we build the program. And thank you very much. I'm going to pass it to Dr. Self.
All right, thank you. Let's see if I can share my screen here. Okay, can folks see my screen? Yes. All right, great. Well, thank you for giving me this opportunity to share a little bit about our program at the University of Minnesota School of Dentistry. I'm Carl Self. I'm faculty at the dental school where over time I've worn many different hats, but currently I'm an associate professor and the founding director of the Division of and Program of Dental Therapy for 16 years. I am currently phasing towards retirement and transitioned out of that role, though, in June. But today, I'd like to share with you a brief overview of our dental therapy education program. You will see that it is a bit different than Skagit Valley, and that's just great. We like to have different opportunities for people to be educated in this profession. Also, I'd like to share some of what we consider our success. School of Dentistry has been the host to many oral health education programs for over a century. We started educating dental students in 1888. A dental hygiene program was added in 1920, and in 2009, we became the first dental school to add a dental therapy program as well. We also have graduate programs for most all the recognized specialties. And while we've had experience teaching all of the skill sets that would be needed by a dental therapist, given their scope of practice, we thought it would be important to understand this new member of the oral health care team and how best to educate them to improve oral health access to care. So we, in the summer and fall of 2028, a delegation of stakeholders from Minnesota went to 3 different countries to see firsthand how dental therapists were educated and incorporated into their delivery systems. In each of those countries, we explored details such as their faculty, facility, scope of practice, level of supervision, and curriculum. And one thing was really clear from all those countries that although dental therapists are supervised by a dentist, it is a separate profession. And as you're seeing by our 2 different educational programs, one size doesn't fit all. There's opportunities to do things differently depending on your needs in your community. So these visits really helped us at the University of Minnesota figure out how to structure our dental therapy educational program. And one of the outcomes was the creation of a set of goals that drove our program design. There were 12 of them. I'm not going to go through them all, but if you've ever listened to me talk, you probably have heard me say these 3 goals. One important one was that the standard of care taught to dental therapists would be identical to that taught to dental students. We have this concept of one standard of care and one standard of education for our students. Our students take courses with dental hygiene students, and they take courses with dental students. And we want to make sure that when a person goes out and practices in the state of Minnesota, it doesn't really matter which program they graduated from. If they're doing a restoration, it's one standard of care. If they're doing an X-ray, it's the same one standard of care. Our second goal was that health promotion and disease prevention would be core elements because, of course, we know we can't drill and fill our way out of all of these issues we have today with access to care. Every member of the oral health care team needs to be able to be versed in health promotion and disease prevention. And finally, the third one was that the education would occur in a team-based setting. And given the fact that we do educate our students together, with the hygiene and the dental students, we find that that has been very beneficial to all student groups. But before I describe our program in more detail, it's important, as Laura sort of mentioned, to understand that in Minnesota, we created two levels of dental therapy: a licensed dental therapist, which has a requirement of a bachelor's degree, and a certified advanced dental therapist, which has a requirement of a master's degree. And while there's meaningful differences between these two levels of therapists, I'm not going to get into that. Both of them are supervised by a licensed dental therapist through a collaborative management agreement. For both levels, there is no requirement to be a dental hygienist. Yet in Minnesota, the vast majority of our dental therapists are dual licensed as a therapist and a dental hygienist. And that's because of a quirk in our bill, which makes a dental therapist unable to do a dental prophylaxis. And so we were the first state to pass state legislation, and that's just one quirk that fortunately has not followed to other states. So our program has gone through many iterations since the beginning. And in 2009, when we first started, we educated only to the licensed dental therapy standards that required, a bachelor's degree, 28-month program. Over time, we determined that it was important that our students graduate with the ability to practice to the top of their license. So in 2013, we started educating to the certified advanced dental therapy standards. It was still a 28-month program, but it required that all of our students get a master's degree. And that created some barriers to entry because you'd have to have a bachelor's degree as a prerequisite. So in 2006, we made the change to our current program design, which is a dual degree, Bachelor's of Science in Dental Hygiene, Master's of Dental Therapy. It's open to anyone who meets the requirements. There's no need for somebody to have a healthcare background prior to coming to our program. We do have 7 prerequisites. They're the common ones for most dental hygiene programs. Like biology, chemistry, sociology, psychology, those kinds of things. And the great news is that our graduates are now eligible to be licensed as both a dental hygienist and a dental therapist when they complete the program. So that dual licensure does allow them the ability to do things like a pediatric prophylaxis and restorations at the same visit. They are also educationally eligible for advanced dental therapy certification. There's other requirements, about 2,000 hours of practice and a variety of other things for them to attain that over time, but they are eligible for that. And our program is 32 months in length, year round. One of the things that people notice is that we have made a lot of changes, but all of our changes really have been driven by feedback from the dental therapy employers in our state. And, over time, we're trying to do the best we can to help them in their efforts to improve access to care. We think that there are some positives to being embedded into a dental school. With this concept of interprofessional education, educating with both hygiene students and dental students, We've graduated 115 dental therapists, but one of the real values of educating in a dental school environment is that we've educated almost 2,000 dentists on how to work with a dental therapist. That has really increased the acceptance of dental therapy in the state of Minnesota, and we're finding that a lot of our graduates, now that they're in positions of being able to determine their personnel structure, are looking to hire dental therapists coming from our program. We have the same shared clinical environment. We have access to about 377 dental chairs for clinical experiences. But really, the good news of all of this is that people are getting instruction from the same faculty, and there's the same expectations across all of our programs. And that shared faculty is really a benefit too. Not only do our students learn from, dentists and dental hygienists, but they get a chance to learn from our research faculty, and they have access to most of the specialists in our school as well as we educate most of the recognized specialties in the oral health care field. So I am also proud of the fact that we currently have 3 of our dental therapy graduates on as faculty at the School of Dentistry. And not only do they educate our dental therapy students, they educate hygiene students and dental students as well. This is kind of a busy slide looking at our curriculum map. I think the important thing is if you look at the colors, given our 8 semesters, this maroon color is our basic and applied sciences, and it starts off heavy first semester, and it gets lighter ending after 6 semesters when they actually graduate with a bachelor's degree in dental hygiene. The yellowish color is our clinical sciences, so they get into clinics starting semester 2, and that increases as they go on through their program. The grayish color is their community-based outreach experiences. And in the 4th semester, they start going out into the community as well. And that increases such that for the last 2 semesters of the program, they're in clinic full-time, either in our building or in an outreach setting in the community. Our admissions process is a little different than our dental school admissions process, or our hygiene process. We do look at an academic record, given the fact that they're taking courses with a variety of students. They need to have demonstrated some history of academic success. But we're more concerned with their community involvement and their history of volunteering. That plays a much bigger role because we're really wanting to make sure that students come in knowing and understanding what it means to be a provider focusing on the health of a community. They do have a structured interview process. They complete an impromptu essay on site. And a lot of what we're looking for, again, is their commitment to the mission of dental therapy. And so when it comes to education successes, we look at employment, we look at graduation. When we talk about employment, the first 2-3 years of our program, it was challenging for our graduates to find employment. Nobody really knew how to work with a dental therapist or what that meant. But over time, that has grown such that in the past 12 months, we've averaged 10 new postings every month for a dental therapist to work in the state of Minnesota. And that compares to 5 a month during the same time period in 2023-24. One little example of how that plays out is this April in particular, before our students graduated in May, there were 20 new postings for hiring a dental therapist. 15 of those came from clinics in Minnesota, 5 came from other states. One of the things people hear sometimes from those who really don't understand what's happening in Minnesota is that in Minnesota, all dental therapists are practicing in our metro area. And I always like to just show people the fact that in this map, you can see an outline of the state of Minnesota. In yellow is our 7 county metropolitan areas. And yes, there's a lot of dental therapists who practice there. 60% or so of our population is in the 7 county metropolitan area. That's where most of our FQHCs operate and a lot of our nonprofit clinics as well. But you can also see by the dots that dental therapists practice throughout the state, north, south, east, and west. And while it's not surprising that about 40% of the dental therapists throughout the state practice in FQHC clinics or in nonprofit clinics, many are surprised to learn that over 55% of dental therapists are currently working in private practice settings in the state of Minnesota. And that's because in greater Minnesota, most all of these dots are in private practice settings. So there's a good mix, and the dental therapists are out working where there is a need. One of the other things that I like to show is some success we've had in capturing students that reflect the demographics of the patients they'll be serving. If you look at our enrollment data for the classes of 2020 to 2028, which is the years in which we've captured this more comprehensive data, 41% of our students identify as students of color, whereas in the state of Minnesota, only 21% of our population identify that way. 42% of our students are first-generation students. 36% come from rural areas, and we all know that the best predictor of who's going to practice in a rural area is somebody who comes from a rural area. So we try and recruit a lot of folks to go back. We've had 32% of our students from out of state, places like Florida, Georgia, Arizona, Washington, Colorado. People who come here, one, recognizing that some of those states don't have an option to practice yet, but they're very committed to the mission and they want to get experience and practice such that when their state is ready to adopt dental therapy legislation, they are ready to go and start practicing there as well. The last thing I want to talk about is our work in creating something called a universal dental therapy curriculum with the sponsorship of the Pew Charitable Trust. Previously, we've created this concept of tools to help dental education programs who are interested in getting started in creating something. So it's a modular approach where all of the information that an institution could use to get started with things is online. They can get from us at no charge. And it's really a resource, not only in the US, but globally as well. And so we felt it was really helpful to have something that would help break down some of the barriers that educational programs find that they've had in creating their own. So this is helpful with curriculum development. And again, I'm not going to go into the details of the slide, but the modular approach is broken into areas. Within each area, there's courses that could be created that would meet what we believe is all the important requirements for educating dental therapists. If a program already has, half of the things they need to set up their program, and they only want to look at, some of the different modules and different courses here, you can take them individually. They're not tied together. They have draft syllabi with them, suggested course content, and when appropriate, suggested competency examinations. And it also gives some suggestions on opportunities for interprofessional education activities. So if people wanted more information about that, we certainly are willing to share that at the University of Minnesota. And with that, I think we are available for questions.
Great, thank you. Yes, we have a few questions that have come in the Q&A box. So one is about what time and cost might be estimated for advanced standing students such as RDHs. What about paramedics, dental assistants, or RNs seeking a change in direction?
Well, I'll speak for our program, and currently we really don't have an advanced standing option, and that's because, as Laura mentioned, originally we were approved to operate by the Minnesota Board of Dentistry, and that was from 2009 into 2021 when we achieved CODA accreditation. And so the Board of Dentistry had stated that anybody to get licensed in Minnesota had to take our program as it was created, didn't allow for advanced standing. So we don't have that option, and I'm unable to share how we might be able to change things now that we're CODA approved to accommodate that and what that might mean from a cost standpoint.
I can sort of say that we're in the process of considering that right now and seeing what we can do through CODA to offer advanced standing for whether it's a dental hygienist or someone with previous course experience. After our first quarter, which is just sort of general education classes that are offered at the normal Skagit Valley College tuition rate, which is very low, all of our remaining 9 quarters are at a $12,000 per quarter tuition rate. So if we do end up getting approval for that for advanced standing, students would be able to bypass quarter 1 and quarter 2. So I'd say that's probably like a $15,000+ savings, maybe closer to $20,000 savings if we can get there, and lowers the time in education around to 24 months.
And I can add, I know Dr. Warren and Dr. Self's programs are both not built around the concept of advanced standing. So, Dr. Warren, you've been able to kind of retrofit it a little bit to allow it. Dr. Self, I know you guys have not been able to as of yet. But I think there's also an option for if a school develops a program from the beginning with a plan. One of the things that you look at with that curriculum map you had, Dr. Self, is showing the way things move over time. You could very much organize something so all of the pieces where there is going to be more overlap organized neatly into earlier pieces, so it's easier to say you're a dental hygienist, you get these 4 semesters off or whatever it is. So I think I would also say that what is currently exists is not necessarily a great example of what could exist. And I would say education costs vary so much by state, by whether how much a state subsidizes its public education, basically, whether a school is public or private, whether it's a college, whether it's a university. There's so much variation. I know dental therapy education in this country, there's a wide range of prices because of just basically how much education costs in those states. I know the cheapest program that I am aware of, North Central Technical College in Wisconsin, is a community college. They do require students to already have a degree in dental hygiene, an associate's degree in dental hygiene, and then that program, I believe, is about $20,000 all in. So there's a lot of variation. So a lot of it's going to depend on how much public education programs tend to cost in that state to begin with.
And I'm sorry, I neglected to mention, but our program is about $100,000 to program completion for in-state tuition. If you're from out of state, it's higher.
Thank you. Somebody had a question about training a dental therapist to work with patients with disabilities. Is that part of a curriculum? Is it something that you build in or somebody can specialize in?
For us, it's part of our curriculum, but I think there's varying degrees of how robust that curriculum is, right? And so you can provide that didactically, and then a lot of the procedures and scope would be, what we train all of our students towards. But then what kind of opportunity can you as a program offer to actually give the students the hands-on experience to work with patients with disabilities. And I think that's really key. And that's just something that we didn't start with, that we've been able to add over time. And so our new cohort will have that opportunity. We haven't had that opportunity directly for any of our previous cohorts, except for treating whatever patients are coming into the clinic to begin with. But now we will have a special training site that offers that.
Great.
At the University of Minnesota, we have a special needs clinic as a part of our institution. And so our students get an opportunity to learn much like our dental students and our dental hygiene students do.
Great. That's that team practice approach. That's great. I'll just do one more question here because I think it's significant. In Minnesota, the dental therapists who work in metro areas, do they also practice in more remote locations, even though their base is in the metro area?
Yeah, and you know, I often talk about this for an hour or more, and so trying to condense things, I forget. But when I was showing the map, those maps were fixed locations where clinics are. But there's a number of organizations, in particular in our metropolitan area, who have dental therapists who, utilizing mobile equipment or other resources, go out into greater Minnesota, whether it's in the schools or into community centers, to provide education and some care. So it doesn't give the full picture of the efforts that are being done outside of our metropolitan area as well. Thank you for that question.
Well, I'm going to wrap it up, and I want to thank all the speakers for joining us today and for sharing more information, because we do get a lot of questions about education. So I think this is going to be very helpful for folks. We will post this on the website in the next day or two, and also I dropped in the chat information on the dental therapy website, and you can sign up for the newsletter so you can. We do have our next webinar is in the works, so we'll be announcing that in the next couple of days, and so stay tuned for that. So again, thank you very much to our panelists, and thank you all for joining us today.
Thank you all.
Thank you.
Thank you.